Runner's knee is one of the most common running injuries and one of the most misunderstood. It's not just about having weak quads or pain that you can just ignore, it'll get better and you can just run through. I'm Matt Sigua, a physical therapist, and I've treated over hundreds of runners with runner's knee. And in this video, I'm going to explain what runner's knee is, the related anatomy and biomechanics. I'll also talk about how I self-test for the injury and then what to do today to improve runner's knee pain. Let's get started. All right, so we're going to start off with anatomy and biomechanics of your knee. So let's start off with looking at the bones of the knee. So this is the left knee, this is the right knee, and we're looking at the anterior portion or the front view of the knee. So we're looking at the front side of it. Now we're going to focus primarily on the left knee. So let's zoom in a little bit here. So major bones, right here we got the femur, the tibia, fibula, and then what we're going to focus primarily on is the patella or the kneecap. Okay, so with these bones, let's take a deep dive into the patella. The patella is pretty simple. It's a floating bone. It's also known as a sesamoid bone, so it's irregularly shaped, and it only has a few features that we need to take note of. So in terms of the landmarks of your kneecap, the top portion right here, this is known as the base or the superior pole of your patella. And then the pointy part right here, this is the apex of your kneecap. This is what we also call the inferior pole. So then you have your superior pole, inferior pole, and then you have your lateral borders or your borders. So your lateral border would be right here. So lateral. So that'd be, let's change the color. So that'd be lateral border. And then your medial border. So medial, that just means towards the center line, towards the middle. So that would be right here. So medial border, lateral border. Okay, so those are the main parts of the kneecap of the patella. Underneath, you have the facets, which are essentially that. Those are just the behind surfaces underneath the kneecap that articulate or move along the femur, right? So it's just the underneath portion of it. So you have your medial and lateral facet. So they correspond with, the borders, the lateral and medial borders underneath the kneecap. All right, now we're going to look at some of the connective tissue around the knee joint, around the patella. So in terms of some of the structures, we have a few different bursas. So for example, you have your suprapatellar bursa, you have your pre-patella bursa, so that just sits in front of the kneecap. And then you also have another infrapatellar bursa that sits underneath the kneecap. So those ones, so with these bursa, just main priority, they just provide a little bit of gliding. They reduce friction between surfaces of connective tissue and bones. So they just make it a little bit easier for your body and your joints and these soft tissues to move. They reduce friction. Okay. So with runner's knee, this is the primary area that people would typically have pain in. So it's kind of right in the front of the kneecap. Sometimes people will report having some of that discomfort underneath the kneecap, which is also common. But in general, it's going to be right in front and on top of the kneecap, and then right above the kneecap. So that's the most common kind of pattern that we see these symptoms present. So right above and right in front of the kneecap in this area. Now, one of the main issues and causes of the runner's knee, which is also known as patellofemoral pain syndrome. So there's an issue with how the patella moves relating to the femur. So with these attachments, with these structures, all along kind of this area of the patella, you have your quadriceps. So the four different parts of your quadriceps that attach to your kneecap. So with those, since they influence your position of the kneecap, so for example, as you extend your knee, your patella actually glides upward as you straighten your knee. your patella will move up. Now, as you bend your knee, then your patella moves or glides down the knee joint. So there's a certain amount of patella movement superiorly and inferiorly as you take it through the range of motion of bending and straightening. Now what happens is, because these structures such as the quads, such as the IT band and other structures that attach to or near the kneecap, if for some reason they become very tight or restricted and they're lacking some of that typical range of motion or movement, now what that'll cause is tension on that kneecap. So for example, one of the main structures that we typically see is, let's go ahead and remove this guy, with your IT band. So then this structure right here is your IT band. And it goes so this little white line right here, it goes from the landmarks of your hip up the thigh, coming down, and attaches to a point on your knee here, on your tibia, called the Gerdy's tubercle. And some of its fibers actually, it doesn't show it in this diagram as well, but some of the fibers of the IT band attach on the lateral or outside portion of your kneecap. So what happens is, with your IT band, which essentially it's like a sheath or a strip of connective tissue. It's not muscle exactly. It's more of just a connective tissue that stabilizes the knee a bit more passively, because you can't actively really contract it, the IT band. But with IT band, it does attach to what we call the tensor fascia lata or latae. And that is actually a muscle. So that muscle, the TFL, pulls the IT band at the hip joint and stabilizes the knee a little bit more. So because the TFL can get tight, technically it can pull and tense up the IT band. So with that pull on the IT band in this area, what that can do is it can influence the tracking of the kneecap, or it influences the movement of the kneecap. So because it comes from the outside, which I'm just going to erase some of these arrows to make it a little bit more clear. But because the IT band pulls on the kneecap, it would pull in this direction. So it would pull essentially laterally. So with that, that's when we'll see the lateral tracking, which is kind of like an unnatural position and movement of the patella. Ideally, it's tracking superiorly and inferiorly as we extend and bend the knee. But whenever you have a structure that is pulling excessively, so more than normal, that'll cause improper tracking of the kneecap, which will put a lot more stress on the articular surfaces or the contacting surfaces underneath the kneecap. And when you have that kind of like malposition over time, it's going to cause more wear and tear, more friction, more inflammation on those surfaces that it's not typically supposed to be contacting as much. So tightness and restriction of that IT band would cause like a lateral tracking of the kneecap. So for us, we want to make sure that any of these lateral structures, such as the IT band, maybe the lateral quad, the TFL, making sure that they're not excessively tight or restricted, so that you can have normal superior, inferior gliding and no excessive side-to-side tracking. Okay, now speaking of tracking of your kneecap, on the opposite end, in terms of the muscles, so if we look at this muscle right here of your quad, so this is the vastus medialis, and specifically like this lower portion right here is called the vastus medialis oblique. So with this muscle, obviously with the quads, any of the quad muscles, they're going to extend your knee, but so this is the VMO here. So let's go ahead and take that out. But with this muscle here, as you can see with some of the fibers, they're kind of angled kind of in this direction, and they attach on the medial side of your patella, of the kneecap right here, right? So what you can envision is as the VMO, as that muscle contracts specifically, and it can be a little difficult to isolate that muscle, but in certain knee angles and positions, it kind of contracts and turns on a little bit more, which is a topic for another video. But as this VMO contracts, it pulls the patella a little bit medial, a little bit towards like the inside, so in this direction of the knee. So it kind of keeps that position and counteracts what would be the IT band over here, the IT band's pull, if the IT band were to be causing some of that lateral tracking. So to counteract the IT band, typically strengthening the VMO, those fibers, to get that medial pull of that kneecap, keeps it on that track. So that's what we'll focus on a lot of times with runner's knee and strengthening the quad specifically. And since we're on the topic of quads, so what happens is when we're running, we definitely use a lot of the quad muscles to perform, the running movement, and that uses and places a lot of stress right on the quads, right on the insertion or the lower part of the quad, so pretty much where they attach to that kneecap. So if you can imagine, if you're looking at the knee joint here, if these quad muscles become really tight, so for example, as you're increasing your runs or you're running more frequently throughout the week and the body is not adapted to that type of workload, that's going to put a lot of stress on these quads, and then naturally they'll get sore and they'll also get tight if you're not working on the proper flexibility or the mobility of the knee joint. So that's why it's also important that we focus on stretching out the quads, and whether that be before the runs or just on your day-to-day, just to make sure that you're not allowing these muscles to shorten. And this is also more common when you see individuals who work in places that they're behind the desk and they're sitting a lot. Their typical day-to-day position is a sitting position. So then essentially these muscles can adaptively shorten, versus if you're frequently bending and straightening the knee, so you're always changing position. So these are one of those muscles that can adapt to prolonged periods of staying in one position. So that's why it's important for runner's knee that we work on flexibility of the muscles around the knee, like especially the knee joint. So one of the symptoms that we're gonna go over again in a second, but prolonged sitting or even like standing up after sitting for a long time is typically painful with people with patellofemoral pain syndrome or runner's knee. So we want to stretch out these quads and also hamstrings, pretty much all the muscles around the knee, just so they don't adapt and get too tight. So now that we talked anatomy, I want to go over how I typically self-test for runner's knee. So you're also looking at the subjective, or kind of what are the symptoms that you typically experience. So usually with runner's knee, how we talked about with running, you'll have that front or back of the knee pain right above the kneecap, with also prolonged sitting. If you stay in a seated position for long and then standing up from a chair, that can cause some of the knee pain that's associated with runner's knee. And also kneeling. If you're ever in like a bent down, like kneeling position on the ground, that typically will cause some of the knee pain, and you'll see that with runner's knee. Now, in terms of self-test, so one of the ones that I like to check just to see if there's inflammation with some of the compression at the back of the kneecap along the femur, so those bones that we talked about earlier. So we'll do typically it's called a Clark's test, also known as like a patellofemoral grind test. So with this, essentially, you're just going to apply pressure down onto the kneecap on the base or the top portion, the superior pole that we talked about of the kneecap, and then you'll essentially yourself or the patient, they would extend or try to tighten up their quad, and if that elicits pain or there's just a lack of mobility of the kneecap, typically that's indicates a sign, a positive sign of PFPS. So let's say we have a positive sign with the Clark's test or patellofemoral grind test, and then with those other activities, you have pain with those. Now, what do we do? How do we improve the pain for runner's knee? So a lot of people will hear from their providers, their medical providers, or their physical therapist even, that, all right, you just need to stop running for X amount of time and then the pain will go away. Well, this is one of the things that I don't typically advocate just stopping the running, especially if it's something that, we really love, we enjoy. It kind of enhances our quality of life to engage in these activities such as running. So there are ways to improve the injury, improve the pain while still running. Now we're going to work on modifying it and addressing the primary factors that are causing the knee pain, so that in the long run you're better off and actually improve the quality and the length of your runs. So the first thing that we want to focus on in terms of goals is we want to minimize the exposure to certain activities. So we want to allow the tissue to heal and to reduce some of that inflammation. So for example, at first, let's say if you're running, 3 to 4 times a week. So one of the ways that I'll typically intervene is, okay, if you want to work on still running that same amount of days, let's decrease the duration. So if you're running 30 minutes, let's bring it down to 15, 20 minutes. So we're decreasing by a significant amount in terms of the total volume, and then allowing the stresses, we're reducing that. So first, you can decrease the amount of time you're running. Now, let's say if you notice a little bit improvement of pain with that, ideally, you want to work in that range where the pain is at a minimal. So let's say if you do get to, you hit 20 minutes and then you're starting to feel pain, but the goal is to run for 30 minutes. Let's stop running right at that time when you start to experience knee pain, because then that pain that you're feeling, that's just your it's signals from that area of your body to the brain telling you that, hey, there's inflammation, there's maybe some kind of tissue damage. So that inflammation, that pain, that's just telling you that there's something going on, that there's almost like an overload of stress of these tissues or of these structures. So listening to your body early on is going to be very important to reduce and keep the inflammation to a minimal amount, okay? Now, in terms of the squatting and prolonged sitting, ideally you're just changing your position a little bit more often than your typical, right? In general, with your day-to-day, you don't want to be sitting for 2-3 hours at a time without getting up at least. So your goal is at least once every hour you're standing up and you're changing your position. If you can do it more frequently than that, then that's better, but at least every hour you're changing your position, okay? So that's going to help with getting a little bit more mobility in the knees, so you don't get some of that adaptive shortening of those muscles. In addition to minimizing the exposures to these positions or movements that cause more pain and inflammation, we also want to reduce and prevent AMI, which is arthrogenic muscle inhibition. So with these pain signals that you get in the knee when you're running, so not only does that cause more inflammation and maybe like wear and tear or damage on those structures of those or the surfaces along the kneecap, it also can cause AMI. So with this, you'll have muscle inhibition. So this pain specifically is letting your brain know that, hey, there's damage happening at this particular area of your knee, and we need you to stop running. We need you to stop doing this activity so you don't cause more damage. So then what that does is it turns off the muscles to an extent, which in turn causes more impact, more pressure on other structures, whether that's at the actual at the knee joint where the surfaces of your tibia and your femur. Now there's more compression there, there's more pressure on the meniscus, and there's just a lot more wear and tear that can occur because now your quad is not firing or turning on properly to absorb some of this shock when you're running, all because of this arthrogenic muscle inhibition from the pain, right? So our goal is also going to be try to prevent that from occurring. So we can also counteract that with exercise, which is what we'll talk about, which ones can help that the most. With that, we do want to focus on adding some exercises that kind of counteract that. So turning on your VMO that we talked about earlier, or your quad muscles. So one of the exercises that I like to use is just a simple quad set. So with that exercise, you're putting like a small towel, or you can even fold up the like the bottom of a yoga mat, putting that underneath the knee, and then focus on squeezing the quad where you're pushing the knee down into that towel. And holding it for a period of time. So this contraction, and usually you want to hold this for at least like 3 to 5 seconds. Like the longer the better. So if you're doing like a 20 to 30-second hold, that will be good just to get that muscle firing a little bit better, getting it turned on a little bit more, especially during like an acute phase of inflammation where you're experiencing that pain when you're running. So this isometric contraction where you're just turning on that quad just helps it wake up a little bit better, and you can adequately turn on the muscle while you're running. Okay, so the quad set is an exercise I like to use. Another exercise that I'll typically add in is working on some of the muscles of the hip, so your hip abductors. If you have, we call it like knee or genu valgum, so where, knock knees, where the knees start to come together. So if that happens, that'll also cause some lateral tracking or malalignment of the kneecap. Muscularly, we actually want to look at the hip. So those hip abductors, if the stronger they are, they actually influence the position of your knee. So as you abduct your hip in terms of using those muscles, it actually gets you out of that knee valgus position. So working on like a side plank clam where you're lying on your side, lifting your hips up and separating the knees, that actually works your hip abductors pretty well. So when you're running and you're landing on that one side, your knee doesn't collapse inward and contribute more towards that lateral patellar tracking. So with these kind of like these side planks, what I like to do is at least like a 30-second hold. If you can only do 15 seconds, then that's fine, but working yourself up to 30 seconds, 45, and even 1 minute, those are good to kind of turn on and challenge those hip muscles. And obviously with this exercise, you can throw in a band right above the knees to make it a little bit more challenging. So to recap, at this point, you should now have a better understanding of what runner's knee is, also known as patellofemoral pain syndrome. You should have a good understanding of the related biomechanics and anatomy in terms of how the kneecap is influenced by tightness in structures or even the position of the knee, and that can result in pain. And now you should also understand how to self-test and recognize some of the aggravating positions and the habits that you do on a daily that can worsen these symptoms. And more importantly, having a better idea of what you can do to modify your running, modify your activities, and introducing proper exercise to improve the symptoms of runner's knee. If you want to learn more about how to run pain-free and how to improve your running, please subscribe to the channel.